Hello, I am Dr. Reid. I am a SAS psychiatrist working in old age liaison in a large acute hospital in the Midlands in England. I am also the chair of the Royal College of Psychiatrists SAS committee. I came to the UK a few years ago from abroad. I'm an international medical graduate who brought with me clinical expertise gained there. And since coming to the UK, I have honed in my skills as a psychiatrist over the years I have been here, but I also gain non-clinical skills and extended roles. I initially was an academic psychiatrist mainly and worked part-time clinically, and I was lucky to be successful as a principal investigator, running large studies and also securing significant funding as a principal investigator. I subsequently was asked to lead a UK government program of research, which I did, and then became a senior medical leader in the UK government for a number of years. During this time, I worked clinically and, like everybody else, became better, and my clinical skills improved significantly. And after this role, I loved clinical work so much that I returned to the NHS full-time, and I have been a full-time SAS doctor, which was the only appropriate position for me contractually, given my background at the time. I have worked in old age psychiatry in the community, covered in patients for a while, and did liaison during this time. And with more development and expertise, I became an autonomous practitioner some years ago. In terms of extended roles, I have always been lucky that I have had people around me who supported me, but also I was determined to follow my passions, so I became an educator and went through several formal positions, but I had a lot of informal experience, and I held position as a SAS tutor. I was the CSER fellowship scheme lead for my trust, and I currently am an associate postgraduate dean for NHS England workforce training and education in my region. I also did lots of service development because I was interested in it, and patient experience at the core of what we all do. Of all the roles and experiences that I had, one that both personally struck me, but also reading the data on it spurred something in me, was the fact that there is some systemic barrier for people in the SAS grades to progress, to access opportunity for development, but also that national data from the Medical Workforce Race Equality Standards team led by Professors Anthony Emmanuel and Professor Partha Kar at that time showed quite striking differences in how people who are from abroad get opportunities and progress in the NHS. And this whole area of culture and equity and equality became very interesting to me. I recall seeing for the first time the GMC data on a race and position in the NHS, and a particular graph showing me that if you're a white male UK graduate of a medical school, you are 3 times more likely to be a consultant. But if you're a female IMG, you're about three times more likely to be a SAS doctor. And clearly this did not seem naturally likely. So the whole work of the national team of the medical workforce race equality standards became very interesting to me, and it opened my interest and passion for redressing some of these inequalities. I'm sure you know that they published a report in 2013 with 5 national priorities, one of them being SAS doctors. And many of the national organizations have in their plans specifically SAS doctors in their race equality standards and equity plans as a point of needing addressing. And this includes the college. I am pleased that things are beginning to improve, and both leadership opportunities and opportunities to develop the career are in pockets improving. But this is one of my extended roles that I have enjoyed the most, and I think has the potential to really change people's experience of their working lives. Now, I hope that you have a wonderful SAS week. I feel that SAS week should be every week. I think that the celebration of this fantastic group of colleagues, which I'm proud to be part of, is continuous. And I would like to say that the SAS committee at the college is representing you, but also to let you know that the college is making huge strides in improving all the aspects of SAS Week themes. And it's really nice to see lots and lots of SAS psychiatrists in extended roles, an increased, albeit slow, in creation of specialist posts. Quite a few SAS advocates appointed and coming, and many colleagues enjoying SAS careers as a viable, enjoyable, custom-made career for them.